So I just woke up from my night shift with the news that the vaccine advisory panel is set to meet this week may vote to change the hepatitis B vaccine recommendation from giving it within 24 hours of birth to starting at age 4. If that sounds like a pretty big change, it is, and it's frankly really concerning, and here's why. So hepatitis B, that's a virus that destroys livers, and I feel like sometimes when we use medical jargon like hepatitis, it sort of makes the meaning of how dangerous this is get lost. So I'm going to call it for what it is, which is the destroyer of livers. So the destroyer of livers is a virus that can infect people. It leads to chronic inflammation in the liver, which can lead to liver failure, liver cancer, and death. And babies are at highest risk of becoming chronically infected. If they're exposed to the destroyer of livers within the first year of life, there's a 90% chance they'll go on to develop a chronic infection and indeed have their liver destroyed. Adults have a lower risk. If they're exposed, there's usually a 5 to 10% chance they'll go on to develop a chronic infection. This is why the vaccine's given so early. Newborn babies and infants are at highest risk. If we push the vaccine to age 4, we're missing the highest risk period. It doesn't make any sense. Now, there's a lot of nuance to this conversation, and there's been genuine questions. A lot of mothers wonder why their newborn baby needs this vaccine if they themselves don't have risk factors. So the classic things we learn in medical school about hepatitis B is that it's spread from mother to baby at birth, and it's spread through high-risk behaviors like sexual contact and IV drug use. And that's what's been widely circulated because, of course, those modes of transmission are real. And so it's recommended that every single pregnant mom get screened for hepatitis B within the first trimester. So some take this and say, okay, if I screen negative and I don't have any high-risk behaviors, why does my baby need the vaccine? The answer is, while those are certainly ways that it can spread, they're not the only ways. The destroyer of liver is extremely hardy. It can live on surfaces for up to 7 days, and it can be spread through even microscopic amounts of blood. This means it can be spread through even casual contact. Something as simple as sharing a toothbrush or exposure to a tiny cut is enough to transmit the virus. We know in 2022, when they looked at new hepatitis B cases, over a quarter didn't have any risk factor known. They got the infection and they don't know where they got it. And we know that moms who test positive are not the only way that babies get it. So before we had this universal recommendation that every single baby get vaccinated within 24 hours of birth, there are about 18,000 new cases of hepatitis B in infants every single year. About half of those cases can be tracked back to their mom, but the other half couldn't. They got it from somewhere else. This is why we know if we only give the vaccine if moms test positive or have high-risk behaviors, we will definitely miss cases, and every year infants will get infected with this virus and will go on to develop liver cancer, liver failure, and death. I feel like unless you work in healthcare or have experienced liver disease for yourself, you don't fully appreciate how bad it is. Some of the sickest patients that we see in the ER are patients who no longer have a functional liver. This is why it's very important that we protect all little babies from the destroyer of livers by giving them a vaccine that we know works and we know will prevent the disease, instead of waiting 4 years and letting them get infected in the meantime.